This is a brief demo of the Altris AI platform. This is your home screen when logged in. New patients will have a little flag right here showing that this is a new patient. The M here is a macular scan. Yellow says there's some suspect images. Red says there's some severe images. D is for optic disc. Green is good. Yellow is suspect. Red is bad. Traffic light system. When you select a patient, it'll show you all the exams over here. When I select an exam, it'll take me to the first tab, which is a single scan, which shows the top layer of the OCT is taken to create a simulated fundus. All the B scans off to the left are color coded. For this particular patient, there are 0 green, 39 yellow, and 89 red scans. You can filter by each. From there, I can come over to the pathology detection tab. On this tab, it's going to show me all the pathology identified, including a drusen count. It'll give you details here as well as what it might be. Altris AI cannot diagnose. It's giving you suggestions, but it's still up to the provider to make the decisions. The referral score right here has the ability to be modified. All these have a weighted average between 1 and 10, and you can adjust those, or you can just turn this referral score off. You can also adjust the colors coming in and out, use them to flicker if you want to use it for patient education, or change the grayscale version of it. Next, we're going to go to pathology progression right here. Pathology progression is going to show you all the scans for this patient in order. Here's your first scan, last scan. I can move through them all at the same time or one individually. If I scroll down, you can actually see all the biomarkers and pathologies for this patient. If I come down here, you'll see confluent drusen. This is saying that from this visit to this visit, there's 66% less drusen. So if I go into that, I can actually see that the drusen count for this patient is actually going up, but their volume is going down. So maybe the drusen is breaking up. Maybe there's a treatment that's working. There's more information here that you can dive into. At this point, I'll look at glaucoma risk. We start with glaucoma by first looking at the ganglion cell symmetry. You can see right here, it's giving you an idea based on this patient's data if there's a risk of glaucoma. If I scroll down, I can move between either eye, as well as I can see all the data for this patient over history, the asymmetry, superior, inferior, and if you want to add in IOP pressure, change per visit as well as over time. If you were to do a wide scan like this patient right here, you can do everything I've shown you, plus you now have this optic disc analysis. With optic disc analysis, I can look at both eyes. It shows me a disc area, disc size, cup area, cup to disc, horizontal disc, vertical disc, rim, and creates a score based on the DDLS chart. As I scroll down, if I were to click on this, it would explain the DDLS chart and how it identifies. This is going to show all those individual variables for each of the dates and total change between visits and total change, and I can move between eyes as well. You also have here at the beginning the flagging system that you'll be able to see right here with the flags, anything that's showing between biomarkers, pathologies, change. It can be used by pharma to identify clinical trial patients. It can be used by staff to look for patients that have change or for patients that might benefit from a specific treatment.